Tell me two things you would do tomorrow to fix PBMs and result in lower prices for consumers.
These other countries.
So I think
Now, either you're the worst negotiators in the history of the world, or something's wrong with your business model. Which is it?
Chaos erupts in the hearing room as Senator Hawley tears into PBM executives, exposing exactly how they're making billions while patients go bankrupt. One question hits like a hammer. Why are three giant PBMs controlling 80% of the market and shutting down independent pharmacies across America? The moment Hawley corners the PBM rep on inflated drug prices, rebates, and vertical integration is the moment everything snaps and the truth spills out.
I think, is that right?
Yes, sir, I believe the only.
The largest and only. Perfect. Now, just help me understand what it is your business is supposed to be doing. You're supposed to be making drugs cheaper for patients. Is that basically right?
We're supposed to help employers and plan sponsors administer benefits at a more affordable point for the consumers.
Okay, more affordable for consumers. That's patients. So you're supposed to be making would you say that you're succeeding?
We've had success in managing the net cost of drugs across most categories of medications, and yes, in large part, but we have the challenge of ever-escalating drug company list prices to work against.
Okay, let me translate that for you. I think the answer you're looking for is no. You're not succeeding at all. Look, let's look at some data. This data shows the percentage that Americans pay more than other countries for brand name drugs. In Canada, we pay 324% more than Canadians pay, 445% more than France, and so on. On average, all together, we pay 422% more than all of these other countries. Now, either you're the worst negotiators in the history of the world, or something's wrong with your business model. Which is it?
Those, if I may, Senator, those are comparisons of list prices. Drug companies alone, as we talked about earlier, set the list price. The PBM is negotiating down the net cost.
Look, this consumers are. You're not telling me that consumers aren't paying more in the United States than they are overseas, are you?
I think the data would tell us that they are exposed to higher price points, and then it comes to an issue of benefit design. The plan decides what your copay is and what you're exposed to.
Yeah, and here's the benefit design. The design of the plan benefits the insurance companies and you. It does not benefit the patients. Patients are getting screwed, if I may. We are paying 2, 3, 4 times more for drugs. People in my state can't afford insulin. They can't afford the most basic drugs. That's when they have plans that are managed by you, and you guys are getting rich off of it. I mean, absolutely filthy rich. The FTC's report, so this is the government report now, found that the top 3 PBM companies generated $7.3 billion in profits between 2017 and 2022. $7.3 billion. That's a lot of money. Why is it that nobody can afford their drugs in this country, but you're making $7.3 billion? That's more than the revenue of some nations.
If I may, 2 points. One, you're not wrong that we need more competition among drug companies. The patent reforms that you all have advanced in this committee, the more we can have competition, we can leverage that to address that cost challenge that we have.
I'm glad you say we need competition, because
second,
don't you think the competition we really need is to break up this alliance between insurance companies and PBMs?
No, sir.
The biggest 3 PBMs are owned by the biggest insurance companies. You're like one huge, giant pharma industry, a giant pharma series of monopolists. Right? Why is it a good idea for the biggest PBMs to be owned by the biggest insurers, and now you're buying up pharmacies as well? Why should we allow that? Why should insurance companies, PBMs, also own pharmacies?
So
How is that good for patients?
It's good for patients and for plans because it's creating optionality in the market.
It's creating optionality. In the state of Missouri, just last year, we lost 73 independent pharmacies. And let's break up the PBM. Let's pass a law that says PBMs cannot own pharmacies. You for that?
No, sir. And we've seen that competition grow in the last 5 years by 18% in the PBM market, by 9% in the last 2 years.
Wait a minute. You've seen the number of pharmacies grow in this country?
The number of PBMs, meaning it's a competitive marketplace.
It's not a competitive marketplace. The biggest 3 PBMs own 80% of the business. 80%. And you're in turn owned by the biggest insurance companies. The problem is there is no competition. It's a racket. It's a total racket. And the people who lose are the patients who cannot afford the prescription drugs. It's time for this Congress to do something about it.
80% of the PBM market is controlled by 3 companies, 3 PBMs, that are vertically integrated. Is that right?
That is correct.
Does your research show that the prices that consumers pay are higher than they would be if those companies were not vertically integrated?
So my research on Medicare Part D...
Give me an answer.
Partially.
What do you mean partially? They're either higher or they're lower.
So
There's no such thing as a partial price.
what I find is that Medicare Part D premiums are higher as a result of vertical integration.
Okay. Well, then why don't we, I'm all for transparency, Mr. Chairman, I want to say that. But why don't we skip the foreplay and go right to the sex and outlaw vertical integration for Part D? Would you accept an amendment to your bill like that?
I don't want to answer that question right now because I want to study that.
Would you support that, Mr. Scott? Let me just guess what your answer is.
No, sir, and I can explain why.
No, you speak Sanskrit. I mean, I'm sorry. You know, you're good at it, and I know your job is to protect PBMs. And I might tell us I don't think PBMs are the only ones at fault, but you don't have unclean hands. Professor Sood, you say PBMs ought to be fiduciaries. To whom?
To both the plan and their members.
Well, what if the plan and the members' interests diverge? Who are they fiduciaries to?
Ultimately, in principle, they should be fiduciaries to the members.
Okay.
So, for example, ERISA makes...
I get it.
Okay.
I get it. Mr. Chairman, again, why don't we skip the foreplay and go right to the sex? Why don't we just amend your bill to require that PBMs have a fiduciary obligation to plan members?
Well, I think that's been suggested, and I think there's part of that in our legislation, but probably not fully enough to satisfy you.
Well,
So let me look at what you want to add to it.
okay. I mean, I'm not criticizing your bill. I don't want my office to end up in Bethesda. So I'm not criticizing your bill. Tell me two things you would do tomorrow to fix PBMs and result in lower prices for consumers.
So I think the two things I would do is...
Very specific.
Yes. I would implement price transparency so that everyone knows what they're paying. And we
Okay,
can-
price transparency just tells us who's screwing whom.
Yeah.
Okay.
And then the fiduciary responsibility says, if you're getting screwed, I can take you to court. So I would do those two things. And those are, I think, better than banning particular practices, because otherwise it's whack-a-mole. You ban spread pricing and something else will show up
Okay.
a year
I
from now.
got 29 seconds. Do you have any other suggestions? I appreciate your
So
straight talk.
the other thing we can do is what I recommended is pass-through of rebates to patients. So suppose a drug...
Say that again?
So pass-through of rebates to patients.
Uh-huh.
So for example, the list price of a drug is $50,000, but the rebate on the drug is $40,000. So when a patient is paying cost sharing, suppose 10%, they should be paying on the post-rebate price. So which is the $50,000 less the $40,000 rebate. Right now, what's happening is patients are paying cost sharing on the $50,000. So this would immediately lower patient out-of-pocket costs. So as Dr. Kircher said, for the cancer patients,
So you're saying the number not to us, the PBMs are jacking up, are encouraging manufacturers to jack up the list price so they can jack up their rebates.
and that...
Is that right?
Yes.
That's
and,
illegal.
And the jacked
That's
up...
illegal.
Yes. I don't know about that, but it...
I do.
Okay.
It's illegal as hell.
Yeah.
Before I call on Senator Ronald, want to remind my members.
Watching that hearing unfold felt like witnessing a heavyweight fight where one side finally steps in to defend everyday Americans. Senator Hawley didn't hold back. He went straight for the jugular, calling out PBM executives for creating what he called a monopolistic racket that's crushing patients nationwide. From the very first question, the tension was thick. Why shouldn't the government break these guys up? In that room, the PBM rep tried to dodge, to spin, to drown the committee in corporate jargon. But nothing could hide the reality that, under their watch, drug prices have skyrocketed while their profits soared. Hearing Hawley cite the FTC report, $7.3 billion in PBM profits over 5 years, put everything into perspective. These guys aren't just middlemen. They're power brokers, controlling the lifeline of patient care, all while pretending to save money for consumers. What really hit hardest was Hawley describing how 2 counties in Missouri now have 0 pharmacies, not one. Independent pharmacies statewide shutting down, while PBMs run vertically integrated empires, from the insurance provider to the PBM to the pharmacy chain itself. It's a system designed to funnel patients into their own companies while everyone else withers and dies out. When the PBM rep bragged about optionality, it was insulting. People in Missouri aren't getting optionality, they're getting shut out of basic healthcare access. The hearing made it clear, PBMs are steering patients toward pharmacies they own, offering cheaper rates to their preferred locations, and punishing anyone who tries to operate independently. It's corporate warfare disguised as benefit design. Then came the bombshell moment, Hawley asking whether vertical integration raises Medicare Part D premiums. The expert witness admitted yes. Not sort of, not maybe, yes. Prices are higher because of vertical integration. And instead of confronting the truth, the PBM rep twisted himself into knots, pretending competition is growing while 3 companies control 80% of the entire market. The most explosive part, though, might have been the discussion about list prices. The expert spelled it out. PBMs benefit from higher list prices because they get bigger rebate cuts. Patients pay cost sharing based on those inflated list prices. This creates a perverse incentive for PBMs to encourage higher prices so they can pocket bigger rebates. Hawley didn't mince words. He called it illegal as hell. The entire hearing turned into a masterclass in exposing corruption, concentration, and the utter manipulation happening behind the scenes. And while the PBM rep tried desperately to hide behind complex market dynamics, the committee kept hammering the truth. This is a rigged system designed by corporate giants, harming patients, killing local pharmacies, and driving drug prices through the roof. This wasn't a hearing. It was a reckoning. And if Congress steps up, this industry might finally face the breakup it's been dodging for years.